Back in May, the CDC decided to only track severe breakthrough COVID cases in order to better monitor overall conditions. But according to a piece in Politico, the agency is using outdated and unreliable data, and it's impacting the Biden administration's ability to make major pandemic decisions, including who needs to get booster shots and when. So joining us now to dig a little deeper into this issue is Politico healthcare reporter Erin Banco. This is fascinating to me, Erin, and also really disappointing. Explain why the CDC decided to only track the most severe breakthrough infections.
Thanks for having me. So the CDC was tracking all breakthrough infections up until May And then in May, they decided to only track the cases that landed individuals in the hospital. Their rhetoric around the time was that, these are the most severe cases. We really only care about the most severe cases because we know that these vaccines are very effective against preventing severe disease and hospitalization. So they wanted to know which cases were breaking through that barrier. However, a lot of state public health departments say by only tracking hospitalizations, it doesn't really give a clear picture of all the other milder breakthrough infections that are occurring, which can keep people, for example, out of work or sick at home or having them transmit it to the kids.
So what impact has the decision had on the CDC's ability to track the spread of the Delta variant and the effectiveness of vaccines?
So what ended up happening is that when the CDC said, all right, state health departments, we only want to track hospitalizations, what ended up happening is that the state health departments had to then go to their physician networks, to the hospitals themselves and say, we need you to report daily COVID breakthrough infection cases. The hospitals, especially in surge times, aren't really set up to do that in real time. So what ended up happening is that the CDC was then getting intermediary and aggregate data that wasn't up to date and did not give them a clear picture of the national breakthrough infection story. So right now, the CDC is pulling all sorts of data from all these various different streams, hospitals, state health departments, and they don't yet really have a good, complete picture of the national picture. They have done more focused cohort studies, which is great, but hospitals and state health departments say, we need better data systems, we need a better way of doing this so we can understand the full scope of things.
I guess, it all depends on what the purpose of the CDC is, because when it comes to the pandemic restrictions and that we've all been dealing with, they're directly connected to the capacity of our hospitals. As long as there are enough ICU beds to take care of the people who are sick, then we're fine. When the hospitals say we're on the verge of running out of beds, that's when there's a push for lockdowns and all that sort of stuff. So that's how we've been sort of determining how severe this pandemic is. But if the purpose is to actually track the movement of the virus, what sort of impact does a vaccine have on the movement of the virus, slowing down the virus? That's an entirely different thing. And it seems like the CDC was just mostly focused on what is the capacity of our healthcare system and what is the impact of these breakthrough cases on that.
I think you're exactly right. And so what we're hearing from state health department officials, local officials on the ground who are really grappling with surges on a day-to-day basis on the ground, what they're saying is we need better data that shows the scope of breakthrough infections so then we can tell who is transmitting the virus. Are they vaccinated? Are they fully vaccinated? Or are they partially vaccinated? Or are they unvaccinated? They need to understand better the ways in which asymptomatic, fully vaccinated individuals who are infected with the virus, have a breakthrough infection, spread the virus to other people. Is the viral load the same? And so what states are saying is we just need better data so we can make our own policy decisions on the ground on a day-to-day basis. And also it's has a lot to do with preparation. If we know XYZ many cases are popping up in this one cluster and the breakthrough infections are happening among this age group, then we can better understand what hospitalizations might look like down the line. CDC officials are saying now when they made their their recommendation for booster shots, that they've already begun to see that vaccine efficacy is waning. They have yet, though, to release really clear breakthrough infection data. They are doing a small study with some states that will give a better scope of things, like I said, but that data has yet to be released. So there are some people in the administration right now who are saying, where's the data? Why don't we have a fuller picture of things yet before we're making these recommendations for boosters? But what they're saying, the CDC, is by the time we see hospitalizations start to rise and then we recommend boosters, it'll be too late.
So what's being done now, Erin, to improve communication between state health agencies, and how long might it take to make some of those improvements?
So the data modernization initiative at the CDC has been an ongoing project for, honestly, years, almost a decade. State health departments have been calling for more federal funding since 9/11, essentially, to update our data systems to make it so we can share data more easily. We can ingest lab results electronically. The CDC this year has begun to dole out some money to state health departments, but it's very limited at this point. And what states are having to do during Delta is they're having to sort of cobble together a patchwork system, spreadsheets, hiring new vendors to make sure that they're seeing the full picture on the ground. But it's going to take years, maybe 5 years plus, for us to totally revamp our public health data infrastructure to a point where we can be prepared for the next pandemic.
It's stunning to me because, Vlad, you remember kind of at the beginning of this pandemic, there was all this talk about, well, the CDC is the gold standard. This is what, and how disappointing it was that we couldn't go to the CDC as the gold standard anymore. And what you're describing to me sounds like, it just sounds so backwards, sort of, and rudimentary, the adjustments that need to be made. It's surprising. It's almost like we sort of slip back in time when you talk about spreadsheets.
Yeah, that's exactly
sorry,
right.
I can see you were about to say something, yeah.
Yeah, that's right. I mean, really what the CDC needs is a better, local and state data infrastructure in the public health departments, because they get 90% of their data nationwide comes from those local state health departments. But if the state health departments don't have the resources they need, and they're still using a data system to track COVID that only works on Internet Explorer or crashes when they get, thousands of lab reports, and they're having to crunch data and manually enter data in spreadsheets, there can be errors. It's human error, right? And if you think about when you go to the doctor, a lot of times when you need to give your doctor papers, you have to fax them into your doctor. Well, it's the same thing with your local state health department. They're getting a lot of these COVID results and other kinds of information through snail mail and through faxes. And then, that takes a week or more to put into the system. And then by that time, COVID is proliferating in the community.
Wow.
So, Erin and Emery, you of course know that last week the CDC released data from 2 studies that showed the waning vaccine efficacy over time, which is a little concerning. So what are you hearing from the Biden administration about this new information, and that the CDC recommends the recommendations for all Americans to get booster shots? They've seemed to be saying that if you're not immunocompromised, you shouldn't worry about getting a booster shot right now. But I think for a lot of people, they're saying to themselves, well, if it's available, I'm going to get it.
This has been a real point of contention inside the administration for the past 2 weeks or so. There are senior health officials in the administration who say the CDC has not released enough data, or enough data that proves definitively that Americans will need booster shots, that the vaccine efficacy studies are not conclusive. The CDC officials argue that they are, that vaccine efficacy does wane over time, and that fully vaccinated individuals will need booster shots. And they say they want to get ahead of this time period where we may see hospitalizations start to spike again in the fall. But again, the CDC is sitting on this other cohort study if you will. They've worked with about a dozen states to get all of their breakthrough infection data so they can analyze it more directly. And so everyone in the administration is waiting for the results of that study. The CDC has been working with that data for weeks on end. But what we do know is that inside the administration in recent days, there has actually been conversations between senior health officials, including Dr. Anthony Fauci and the Oval Office, the president, about whether or not those boosters actually need to become before that 8-month marker, perhaps in 6 months after you're fully inoculated. So it's very confusing for everyone involved. And so it should be said, though, that the CDC is planning on releasing more of that data in the next couple of weeks, though they have been saying that for about a month. But I think, before the real start of the school year or before it really kicks off, we'll see some of that data come to light.
All right, Erin Banco, thank you so much for your reporting and analysis. Really fascinating stuff. We appreciate it.
Thank you.